Good afternoon. My name is Jacob. My last name is Zhou, Z-H-O-U. Today I'm going to perform medication administration. And to do this, in the first place, I will check the book drug guide. Here I don't have the drug guide, but I have the reliable information about the drug I'm going to use. Here I have the drug name, generic and trade names too. The generic name is acetaminophen. The usual trade name is Tylenol, as we are familiar with. The classification is pregnancy category B, and I see that the indication of the medication is for the treatment of mild pain, fever. And here I also have the action of the medication, including its onset, peak, duration, and on this information sheet, I also have the medications contraindications, adverse reactions, and interactions, and health teaching points. And after checking the drug knowledge, I will put the drug guide away. And next, I'm going to go over the organization's policy regarding medication administration. I will confirm to the organization's medication administration policies. So I put it away. And next, I'm going to open the doctor's order. I checked the doctor's order and take out my worksheet, and I get the relevant information from the doctor's order, including the client's name, that's Sid Garland, date of birth 11/08/1965, and the client has allergies of penicillin and codeine. And also look at the doctor's order, acetaminophen 650 mg POPR every 6 hours for 4 days, and the special instructions do not exceed 4 grams per day. I also checked the patient's past medical history, also his current medical status. I see that he has multiple medical conditions, including hypertension and wound. So after checking the doctor's order, I will put it away to make some more room for my workplace. And having the information ready, I'm going to do the medication administration itself. First of all, I would like to open the worksheet. I was opened the signature sheet. I was write down the date, August 6, 2020, and my full name. I write it down, and my student's status. My status is practical nursing students first year. It's SPN1, and I sign my full name, my initials here. Then I close it, and next I will do the pre-assessment of my patient before I giving him the medication. And with my worksheet, I will wash my hands and then go to the client's room, asking if he feels comfortable or if he has any pain. He told me that he feels mild pain, and I asked him to rate the pain on a scale from 0 to 10, with 0 for nothing and 10 for the worst pain he has ever experienced. He told me that he experienced he rated the pain as 4, that it's mild. So I know that's the medication acetaminophen. It's good to use on him. And after the pre-assessment of the patients, I'll come back and wash my hands again. And then I will open the drawer and taking out the medication. Immediately I see that on the medication label I have the medication's name, acetaminophen. That's the right medication. And I checked the expiry date, August 2025. So I can use this. Medication. Next, I'm going to do my first check with the MAR and the medication label. I see here I have Garland, the Garland CID, and then I realized that the name of Garland has a different spelling from what I got from the doctor's order. So I will check that with my head nurse. With the go-ahead, I can proceed. So the name, and then the drug, acetaminophen, dosage 650 milligram, 325 milligram. I will do the medication calculation. And the root PO, PR. Here I don't have the root of the medication on the label, but it says in the form of tablet. Tablet, it's good for PO. And I also have the frequency every 6 hours. The label doesn't say anything about frequency, but I know that's from the doctor's order. It is administered every 6 hours. And the time, since this is to be given every 6 hours, here the first time was given at 6 o'clock. The second time, there should be a 6-hour interval. So at 12 o'clock, this is good to give. So it hasn't been given. I can give this to my patient at 12 o'clock. And then I have the site. The site is by mouth, there's no doubt. And the reason to give this medication, that's for mild pain. Yeah, I know that from the drug guide that I know acetaminophen is for mild pain and fever. And the doctor's order says we can give it to the patient for mild pain after operation. So this is the first check, and immediately I will do the second check. I'll do that again. Garland, CID, drug acetaminophen, dosage 650 milligram to 325 milligram, and the root PO. Here the medication is in the form of tablets, so it's good to give by mouth. And the frequency, site by mouth, and by mouth tablets. And frequency is every 6 hours. From the doctor's order, I know that it can be given every 6 hours. And the reason to give this medication, so that's for post-op mild pain. I know that from the drug guide, this acetaminophen, it's good for mild pain. So I can give this to my patient. I also noticed the special instruction from the doctor not to exceed 4G per day, and the doctor's orders says not to exceed 4G per day for 4 days. Okay, that's the second check. And after the second check, I'll do the math. I have the formula here. That's dosage over what is available times quantity. Here dosage I have 650 milligram over what is available, it's 325 milligram times 1 tablet. And I do the calculation on the calculator. 600 divided by 650 divided by 325, the answer is 2. I got 2 tablets here. Then I box it. And that's the first calculation, and I have done the 2 checks. Next, I'm going to wash my hands, and I'm going to pour the medication out. That's 2 tablets. Oh, sorry, I made a mistake. I will first pour the medication, 2 tablets, into the cap of the medication bottle, and then I transferred the 2 tablets into the medication cup. Then I close the cap on the bottle. I have the medication in the medication cup. Then I'll do the 3rd check. That's the last check. I have Garland, sit, acetaminophen, dosage 325 mg, 650 mg. I'll do the math again to confirm the correct answer. And then the root, POPR, and the label doesn't say anything about the root, but I know that it's in the form of tablets. It's good to give it by mouth. And the sides by mouth. And the frequency is every 6 hours. From the doctor's order, I know that it can be given 6 hours for this medication. And the time it's there are 4 times to give this medication in a day. The first time was given at 6 o'clock by PO, and there should be 6 hours interval, that it's 12 hours when I can give this medication to the patient. So I note the time is right. And this reason to give this medication, it's mild pain, post-op mild pain. I know this acetaminophen, it's good for mild pain, so it's good to give. That's the 3rd check. The 8th right of medication administration. Next, I'll do the calculation of the meds again, and here I have a different on the different side of the paper. I also have the formula first. That's the dosage, D over what is available, A times quantity. Then I have the dosage, it's 650 milligram over 325 milligram times 1 tablet. And I do the math on the calculator. 650 divided by 325, the answer is 2. So I got the answer 2 tablets here. Then I box it, 2 tablets. So I have the correct number of tablets here in my calculator, in my medication cup. Next, I will sign my name, JC here with the slash, and then the root PO. At this moment, at this point, I'm going to call in my tester, my teacher, to co-sign. And the teacher has come and she has signed by my side. And with the go ahead, I then can proceed. So I'm now going to the patient's room. Of course, I wash my hands first before I go into the patient's room. And I'll first check the client's identity with reference to my worksheet. I will ask the client to state his name, CID, Garland, and then his DOB, date of birth, and ask him if he has any allergies. He has penicillin and codeine, that is confirmed from him. And I also checked the environment. I make sure that the suction on the wall, the oxygen on the wall is working very well, and I put the call bell within the patient's reach. And then I also prepare him for some health teaching before I give him the medication. I'll ask him what happens if he has taken the medication with codeine or penicillin. I know that usually acetaminophen is very safe to administer on anyone, but we are also looking for something like rashes or itchy areas. In that case, the patients can press the call bell immediately for help. And I also teach him that drinking a lot of water can increase the absorption and metabolism of the medication in its body. So I tells him that he should not drink any alcohol, and make sure this works very well in his body. And okay, and with those health teaching and environmental check done, I then put him in a comfortable position, usually in high Fowler position. Then I offers him a full glass of water and gives him the pills, the tablets to swallow, and I watch him swallow the tablets, and he finished drinking the glass of water. And then I will make sure that everything is fine. Make sure he's sitting in a comfortable position. The bed is in the lowest position. The side rails are up, not on his side when he gets out of the bed. And I also offers him another glass of water for him to drink in case and then I will come back and do the documentation. And yeah, that's the documentation we have signed, MAR. And I think that's it. Thank you very much.